Welcome, Phara, and thank you for joining us.
Thank you for having me. I'm really excited to be here.
So we'll jump right into it. Phara, you're a nurse, a candidate, you're a human being during a pandemic. Can you please talk about your experience as a nurse during this time?
I am excited about working now. I know this is not usually the sentiment, but it's really important to note that it is hard work, but what makes it exciting is that I've never seen so much collaboration in my life before. And so as a nurse, I am working both in a residential area, residential facility, and I'm working as visiting patients in their homes. And on both parts, I see that patients are struggling. Patients are struggling to cope with not only the regular being pregnant or being a teenager, but then also putting on top of that COVID-19. And so it's a lot to handle, but I think that both patients and staff are rising to the occasion. Now, on the other side, it's dangerous work because, sometimes we're working without the proper equipment. Short staffing is real. And then you add on to the fact that you're in a patient's home not knowing what to expect, or even the trauma of being, some of the kids that we work with, they're taken away from their parents because, well, not taken away. They're separated from their parent or their mom because that parent is sick with COVID-19. And so they need to have a guardian take care of them until their parent can take care of them. So these issues are, it's not simply just getting sick or protecting yourself. There's some social ramification that is felt. And so that's the realm of nursing that I work in.
Thank you for sharing that. Changing gears a little bit, you posted recently that your husband was diagnosed. And can you talk a little bit about what it was like navigating our healthcare system with him for that? What was working, what didn't work?
Right. And so I'm a nurse, and I am a very pushy nurse, and I'm a pushy patient. And so being in the situation where my husband was sick with COVID-19, that was very difficult because, I couldn't be a nurse there. I couldn't even be a pushy patient because I was not the patient, And so taking him over to the emergency room and then having that conversation where my husband is barely able to speak, but I'm on WhatsApp like, hey, I'm a nurse, what should we do? And they're like, well, take him home. We know it's COVID. We can't test him for it because he's not being admitted into the hospital, but we know it's COVID. But yeah, you could take him home now. Give him water, make sure he's okay. Come back if it gets worse. That is the worst feeling. That is the worst feeling as a caregiver, to not be able to give care and you're not giving it adequately because of what? Bureaucracy, excuse me. And so that was super, super stressful. But he got better because I am a nurse. I gave him his fluids. But that was very difficult and then the slap in the face was the bill. We got charged $150. And I'm lucky to have been charged $150 because we had insurance. And so the misinformation, and that's when you go in, oh, you're reading the bylaws of your script. Yeah, you can get corona care, but he has to be actually tested. So it was too much. It was way too much.
Yeah, that sounds incredibly stressful, but I'm glad to hear he's doing better.
Mm-hmm. Yes, thankfully.
Moving forward, I guess most people don't associate public health with the climate crisis, but from destabilized ecosystems to poor air quality to unclean water, we're seeing over and over that people are only as healthy as their environment. And for example, there seems to be a link between susceptibility to COVID-19 and the level of air pollution and individual experiences. So I'm wondering if you've noticed any public health effects of climate change that have exacerbated this crisis. Is there like a link there?
I definitely think when we talk about COVID-19, right, the susceptibility is not only just comorbidities, but specifically respiratory comorbidities. And so when you have people who've been living in areas highly pollutant, filled with pollutants, and then, you know, they live in starret cities. So of course you're predisposed to asthma, that's a comorbidity. And now you add on the fact that you have a disease that is attacking your respiratory system. We clearly see that climate change we have pollutants, right, in the air causing a problem, and then having a disease that only exacerbates the issue, you know? And so that is something I've seen directly when we talk about COVID-19 and health, right? I mean, I foresee, I hate to be the one to be like the bearer of bad news, but I foresee like way worse. Like this isn't just an issue where it's, you know, do you have asthma or do you have COPD or something like that? I foresee this affecting more reaches, because as we see that the less insured you have, the more prone you are to disease because you're not getting preventative care. And so this is just the first wave of issues where we see climate change and then your health being at risk, you know? I see things such as your health being affected more so, like as we continue to see changes in the climate, like heat waves, heat stroke, right? You could die from heat stroke. If we continue to have high heat waves, then you can imagine if you're an elderly person or someone who's susceptible to dehydration, that's you right there. That's not respiratory, that's your circulation right there. So I do foresee climate change being even more hot topic in the health field.
Yeah, and that ties right into the public power campaign, because as the summer approaches, people are going to be at risk of blackouts, and blackouts during this time would be even more disastrous than usual. So I guess moving on, how would a Green New Deal address the problems with the healthcare industry that COVID-19 has brought to the surface?
Definitely. So I like to think, first of all, the Green New Deal tackles a couple of things, right? Getting off of fossil fuels, right? So once we completely disinvesting and removing fossil fuels in our system, in our public system, power system. Oh my God, I'm tongue-tied. Power system. But the idea that we are not adding any more carbon emissions, or we're trying to decrease carbon emissions, that's the goal, right? And not even just by 2030, but to keep it that way forever. So that will help decrease, right, the amount of pollutants we put into the air. Better air, cleaner air, that's better health, right? But then also, I see that when we make green jobs, union jobs, green jobs have to be union jobs, right? That's also looking at the types of jobs that we're promoting. Nursing is I think, a green job, because there's not much we need that is like related to carbon to do our job. So I think that that's another way I could see like healthcare being tied to the Green New Deal. And then when you look at the idea of public power, right? Publicly, democratically owned public power, you're focusing this idea that people have a say. One of my fears is blackouts. And from a health standpoint, you're thinking, when I think of blackout, when I see blackouts, I see people not hooked up to their ventilators, not hooked up to the refrigerator, insulin, medication spoiling. So that's what's in my mind, right? And so that is a scary thing. And that's why we need to make sure that our public power system is democratic, is publicly owned. So that way we can say, hey, you're not going to cause blackouts on us. You're going to make sure that you're building a system that is equitable and that is actually efficient for everyone. So Green New Deal isn't just about the air, it's about healthcare too.
Yeah, that reminds me of something like one of the, I guess, 4 tenets of the Green New Deal that we talked about in the first episode when we interviewed the authors of A Planet to Win, and they were talking about how like care work is our green jobs because they like significantly increase people's quality of life, but they're not producing a lot of pollutants or anything. But I'll pass it over to Darren.
To actually win a Green New Deal, we do need a broad coalition of workers, and nurses can be a big part of that.
We got pulled over by the police.
Oh no.
1 sec.
Sure, of course.
All good?
Yes, all good.
Okay, cool.
Sorry about that. Of all the things that you
okay,
would
right?
think that would happen on a show, get pulled over by the police. All right.
Wow.
Okay, go ahead.
So,
repeat that question for me, Darren.
Absolutely. So, so to win a Green New Deal, we actually need a broad coalition of workers. The National Nurses Union is a really progressive union and was an early backer of Bernie Sanders' campaign. It could be a crucial Green New Deal ally. In New York, the New York State Nurses Association has been a really great ally to DSA. What can we learn from organizing nurses, and how can we as eco-socialists build coalitions with healthcare workers?
Of course. I think that when my whole deal while I'm running for office is to keep thinking about ways to further make sure that groups understand that all these issues are relevant issues, right? And so when we talk about, for example, nursing, we talk about the New York Health Act, right? Which covers not only just healthcare, but public funding into hospitals and stuff. So when we are thinking about necessarily how do we build a more sustainable society, we have to cover, everyone has to see that they have a part to play in. I know my hospital, we switched to complete, we went off the grid, so we're not on the grid anymore. But that's a part of health we have to talk about that. And that's actually something that nurses was pulling for, because again, we know the dangers of not having a reliable source of power during a crisis. So that's one part. And then again, nurses are people too. You know, I live in Crown Heights. I know that blackouts are a threat to us, right? So it behooves me, both as a nurse, as a tenant, as someone who lives in the community, to step up and make sure that I'm fighting for the issues and my union is backing me up. Labor needs to understand, and I know that they understand, excuse me, I'm not saying that they don't, but labor is tied to the economy, which is tied also to the actual the environment that we're living in. You know, when we talk about when we talk about the environment, we're also talking about workers' protections, right? If the neighborhood that we're working in, the environment that we're working in is unsafe, that's also our health as workers too. So I look forward to building more coalitions with different groups. I'm excited that NYC-DSA is backing up public power, and that's something I'm excited to continue to work on, both as a DSA member and also as a nurse.
Yeah, so we've seen a ton of shows of support for healthcare workers, like the flyovers and the clapping at 7, and even the proposed parade. But I guess, is that enough? Is obviously no. So what can we do to actually support healthcare workers?
I think the best thing right now is 2 parts. I love the fact that there are the flyovers. It really is a sign of solidarity. Everyone understands that healthcare frontline workers. And I'm not just talking about nurses and doctors. I'm talking about the clerk. I'm talking about the manager that has to come in and hand out masks on the floor. Like, everyone that is going in and out of that facility deserves applause every day. But what's the next step? Has to go beyond just the applause. Again, continuing to push for proper equipment, proper personal equipment. If we don't have the mask, then the gloves or the gowns, then the hospital is just a cesspool for COVID-19 and other diseases. Because a lot of people forget, there's still MRSA, there's still other things that could get you in the hospital. So this PPE goes beyond just COVID. It's for the safety of staff and patients. And so when we're calling out for that, I would like everyone to continue to put pressure on your elected officials. I mean, right now, we are looking at,
if you get it fixed by tomorrow, it gets taken away. All right, you just got to get it fixed.
It was a broken brake light. All right. So, and then when we look beyond just the PPE, putting pressure on your elected officials, please, please, please call them up. Let them know about the New York Health Act. Let them know about the connection between the environment and climate change, and the fact that our health depends on these changes to happen, and changes to happen quickly. And so then when we're finished with all of that, we still need to make sure, honestly, the way you could thank me as a nurse is to make sure that I am safe and that I'm able to be in my home, right? So if I can't pay the rent, that's still an issue, right? If I have student debts piling up on me, that's an issue. So other than just keeping up the push for PPE and also the New York Health Act and the Green New Deal, show me how you really feel. You know how, like, after 9/11, they had a whole stimulus package? How about you give me some mental health care for all this trauma that I'm experiencing, seeing my nurses fall or my doctors fall victim to COVID. I am mourning. I'm in grieving. How about that? How about you set up a monitor my health? I mean, I've been exposed. My cohorts have been exposed. How about testing for my family? How about testing for the community? That's how you really thank a nurse. That's how you really thank a doctor, or show that you are in solidarity with us. Real protections for us.
Going back to one of the points, one of the pillars of your campaign, the New York Health Act, it's huge. But Cuomo just cut $400 million from Medicaid. How do we get the New York Health Act and other public health measures passed with a governor like that?
So at this point, if we're not actually in session, then what are we gonna do? What are we gonna do? At this point, we really need to call and make sure that we continue to fight. And that means that we have to be in session. So if, as a politician, you're not calling for the reinstatement of for us to be in a space where we can legislate, it's not gonna happen, you know? And then being very mindful, okay? When you talk about healthcare, but yet you're cutting $6.5 billion, then that's just a slap in the face. You're saying, oh, PPE is important, or we need to support our nurses and doctors, or we need to, really, please, we accept donations, but you cut $6.5 billion from the budget. You're two-faced. You're two-faced, and I don't trust you. That's my clear, response to that. You're two-faced. So we need to call him out on that. You can't be talking about public fundings and supporting Kings County when you just cut $6.5 billion. You still have a Medicaid redesign team that is fixated on cutting mental health services. You have a population that is experiencing trauma, but you're cutting health care. No. Cut the malarkey. cut the nonsense. And that's what I would really do. I would call him out every day. That's, if you ever see my Twitter, that's what I do. Call him out every single day until he gets the point. And hopefully people will join me in calling his office, sending him emails, knocking on his door. Well, we can't knock on his door anymore, my bad. But calling him, emailing him, leaving voicemail saying, listen, stop that. We know what you're doing. You're not our hero. You're actually the person who's sending us to destruction. Period.
Yeah, I wish a lot more people would call out Cuomo like that. That was really on point. I guess maybe on a more positive note, we have seen historical upticks in both housing organizing and organizing among healthcare workers. So how do you see this continuing beyond COVID? Or, I don't know, is there something that's happened during the COVID crisis in terms of organizing that you're really proud of?
Oh, I'm so super proud of the mutual support, the support that different people are giving to like, I just came from a mutual aid, which is why I'm still in the car. But to meet up with people that I've never met before, and to say that our commonality that we are all in the struggle together, that is a beautiful thing. And I was just discussing this with an organizer. I don't want that to stop. That fire we have right now, I don't want it to stop, because what we're organizing on is, again, the issue that we as the working people have stacked against us many, many different odds. Housing, healthcare, economic. We have the idea that that a supermarket can even jack up prices on food on top of a crisis. That is ridiculous. That feeling must not go away. But I don't think it's going to go away, because I think we've got this awareness now. Hold up. Something stinks. When I'm calling people on the phone about the campaign, we always lead in with, how are you doing today? Are there any concerns that you have? And no matter who I'm calling, the concerns are very consistent. They're very consistent. People are caring about how they're going to live, how they're going to eat, how they're going to sleep. And this is what we're organizing around. Cancel the rent, right? We're organizing around getting people the food and the supplies that they need. And we're very good at it. And I don't think it's going to go away. I'm so excited. And that's why that's even sending a clear message to our legislators that we want organizers in office. We want organizers in office. We want people that know the struggle and are ready to fight to end the struggle.
I know I speak for everyone saying that we're incredibly impressed with you powering through whatever that flashing light was, the cops.
Yeah, it really kept your cool. Very impressive.
So now we're gonna hit you with the harder questions.
Sure.
What's your go-to bodega?
My go-to bodega is the corner store on Franklin Avenue and Carroll. I always get my Philly cheesesteak there with my pepper jack cheese. Yes, extra onions.
Okay, good. I'm glad we didn't lead with that one. We snuck it in towards the end. But Phara, how can our viewers get involved in your campaign?
The most important thing is volunteering for phone bank. It kills me that before COVID-19 that we were able to knock on over 21,000 doors with over 300 volunteers. And the volunteers are so psyched up about what they were doing because they were talking about issues that they care about and then tying it to the campaign. And so I am glad and I'm so happy that we still have that opportunity to do that on the phone bank, through phone banking. And so even tonight, the eco-socialists and the labor groups are online right now making phone calls for the campaign. And I know that if you are fired up about the same things I'm fired up, I want I would love to have you on the line and join me in letting constituents know that not only are there issues on the table, that they're up for discussion, and not just up for discussion, they're up for fighting, okay? But also that there's a candidate that is pushing and pushing for it. And that really means it. It's not a joke. It's real. Like, this is stuff that we really need, and our communities need it. And so if you care about that and you want to make a difference, please join us on the phone and call up our neighbors and let them know that we are here to make a change. And this campaign is all about it.
Yeah, phone banking can be kind of intimidating if you haven't done it before, but I think actually right now is a great time to do it because people are dying to talk to people that they don't live with because they're stuck at home. And also, I think people have a lot to say right now. So it's good if you kind of like lead with a question about, you know, what's on your mind. I think you can actually have really good conversations.
When I first had gotten on the phone, I was scared. I'm scared. What is my campaign now if it's not knocking on doors, you know? But it's very, I have to say, it's kind of therapeutic, in fact, you know, to meet and to talk to people and let them know, hey, you know what? We got your back. We got your back. Let's talk about it. And by the way, if you are interested in volunteering, you can always go on my website, pharaforrassembly.com, Phara forrassembly.com, and sign up through the volunteer link.
Phara, is there a question or topic that you didn't hear but you wished we brought up?
I think a lot, what I'm finding a lot, and it seriously irks me, and I actually was talking to some of the volunteers about this because it came up a lot during our phone calls. The discrimination that is occurring when it comes down to the enforcement of social distancing. I think that this is an issue that keeps coming up again and again. And the underlying issue is that their communities, people of color, have been systematically targeted time and time again. And this is not the time to, you know, target people. I think that is deplorable to hear that, you know, someone say, the union president bring up that during a phone call with the mayor, saying that, oh, a punch is a appropriate response when a person is just asking a question about why you are attacking someone due to social distancing. So again, to have that man say that, and then, you know, the mayor to just yes it away. Jesus, I don't know what's going on. I think that we really need to have real conversations about policing around social distancing. I don't even think that police are appropriate for the enforcement of policing, but the enforcement of social distancing. But that's one thing I care a lot about. And then also when we talk about housing, there's a lot of questions come up. You know, am I against one group versus another group? I think that right now, when we talk about housing is a human right. Housing is a human right, period. Healthcare is a human right, period. To hear that there was a situation, to hear that people are sick from COVID-19 and they're getting evicted from their home, from their room that they rented, that is deplorable, that is disgusting. This is why we are fighting for cancel the rent, to ease the burden of people. This is not fun. To go on a rent strike is not for fun. We're doing this because it's out of a necessity. We are struggling. And if you aren't struggling right now, it's because you're not struggling today, but you will struggle tomorrow. Because at the end of the day, if we are not working, if we're not producing, and housing is still for profit, then we'll always be pushed down in the name of someone making a buck off of us. And that's the issue behind canceling the rent and rent striking. It's not because we want to have fun striking, you know.
Thank you for bringing up housing. And actually that ties to a question from Lawrence. Lawrence asks, you're a tenant activist who helped win some of the strongest tenant protections in New York State history. What lessons can we take from your victory to win public power and a Green New Deal?
What I found was the most powerful point in my organizing with housing was the day that the tenant movement went to Albany and literally put it out all on the line and got arrested in the name of stronger rate stabilization laws. Let me tell you something, this fight that we're fighting is not a fight that others want us to succeed in. They'll give us crumbles, they'll give us pieces, but once we get very clear with our demands, as we have with the Green New Deal, clear with our 5 points, those are very strong points, and it won't be won easily. So from what I learned from the housing movement is that you literally have to put it all on the line, all on the line. So I am ready. You heard? I am ready to get up in Capitol building and literally get arrested again, because that's what's going to be needed. I foresee that. And we could, there's a lot of steps before that. As we saw in housing, we called our elected officials. We did a lot of emails and mailings and demonstrations and rallies. But it wasn't until we put it all on the line that we got it permanent. And even then, we still got to battle for good cause eviction bill. So these are the things we got to get prepared for that. We have an uphill battle, but once we get together and we get serious about it, during that housing movement, the arrests, they were over with the Housing Justice Coalition. That was a representative of over 70 groups across the state that culminated in that event. And so it took a lot of power. It took a lot of hours, but that's what we had to do. And we're going to keep on doing it for all the issues.
Patrick is asking, Pelosi's Heroes proposal would bail out landlords basically with unlimited funds. How can we build resistance at the national level to win battles here in New York?
That's Nancy Pelosi, right? I don't know the full details of this. Let me just be right there. But what I do understand is that for years, politicians have been in the hands of real estate developers, management companies, corporate management companies. And so it makes sense to propose things that would, to them, to Nancy and all her friends, right? To propose things to bail out the landlord and not the tenant. What I think that needs to happen, and this is why me along with the other DSA slates and some other left candidates, the reason why we're not taking real estate money or corporation money is for that very fact. Why are you bailing out landlords? Why are you bailing out the landlords that have for years stepped on our necks, broke our backs to make profits so that they can sit comfortably and we continue to struggle as working people? No, I don't stand for that. This is why we're pushing back with cancel the rents, right? Rent strikes. If you don't like it, then guess what? Join us, right? Because then we, the tenants, have more power. We are more numerous. We are the ones this is why we need to elect people like me, because I'm a tenant. I understand the struggle. So No, we're not doing that no more. Mm-mm. No more landlord bailouts. No more bailouts for Wall Street. So that's her putting that out. That's just very clear to me whose side she really on. You'll never hear me say nothing like that. You'll never hear Jabari or Zoran saying some craziness. And if you don't know Jabari and Zoran, that's the other slave members. You'll never hear them say that nonsense like that. No.
Yeah, we'll post a link at the end so that people can explore all the candidates if they're not familiar, but hope you are, because they're all great. But yeah, we recently just released a utility strike toolkit. And a lot of the talking points are exactly the same, you know, stepping on people's necks for years, reporting like huge profits every year and still making a profit and not even offering to cancel the bills during this time. And the only difference, well, not the only difference, but one of the big differences between like a rent strike and a utility strike is that with the rent strike, people can, landlords can like pull this line where it's like, oh, well, what about the small landlords? You're like more people too, you're hurting us. But like, there's not a mom and pop utility, as Daniel says. It's just like this big entity that's just has a monopoly. So I think a lot of what you're saying applies there as well.
Yeah, and that's why we needed to be democratic, and that's why we needed to be public. Take it out of the hands of these shareholders and really put it back to what we need: efficient, clean, and affordable power.
Yeah, I think you spoke at our Flatbush Public Power Town Hall, and I remember when you said Con Edison and National Grid have been conning us, it got a big applause because people want to hear that.
Daniel asks, how can we leverage mutual aid networks to build power for our electoral campaigns?
So what I think that, and why I'm super proud of the mutual aids that pop up, the mutual aid networks, is that they are built on coalition. They're built on this idea that we can do it ourselves. So that is a scary thing. When you say you are governor or you are speaker of the house or whatever it is, like when you say you're Andrea Stewart cousin, you're basing your power based on the fact that I have been given power, right? That me solo, I am the power figure. But we're saying no, actually, despite this crisis, we have the power to make change in our communities, make sure that our people are safe, and we got each other's back. That is scary for some people. It's empowering for me, because that's what I was waiting for. I was waiting for people to stand up and say, hey, hello, we don't need to wait for nobody. We can do it ourselves. They don't want to hear that. They don't want to hear that. So when we are able to, that's our leverage. We're able to then say, oh no, actually, Mr. Incumbent, while you were sitting to the side, not doing much for us, we had it, we did it. Now, you know what? You need to step aside and let somebody who's really got our backs to stand up for us. So I think that this is much leverage. I love it. I love it. And thank you for that question, Daniel. That's a good question.
Well, I think that brings us close to the amount of time that we've allotted for questions. I want to thank you for not just being on the show, but really powering our Public Power Hour.
Thank you so much.
Give you the chance to talk about your campaign a little bit, a few minutes.
Okay, so my campaign, so we're not just talking about Green New Deal. We're talking about healthcare for all. We're talking about homes guarantee. We are talking about a real platform. And then we're also talking about economic justice, really about putting power behind what really shapes our communities, which is job training, job opportunity, right? And then the question that was asked, there was no racial profiling. I don't think so. The back brake light is really out though, and the front one too, if you really talk about that. So there's no racial profiling that happened here today. And so when we talk about these different platforms, we're also talking about actually racial justice too, right? The idea that if as socialists, if as democratic socialists, we say that we are doing, right, something for each other, something for the community, if it does not uplift the most vulnerable and the most disenfranchised communities or peoples, then you're not doing much. And so that's why I'm so excited to be a democratic socialist, because I clearly see how each of these different fights can always comes back to who are we trying to help? Who are we trying to put forth and uplift? And so I'm really, really excited to run as a democratic socialist. I'm excited at the platform. You can read more about it online. And then my campaign is an open campaign. You know, please flood my box with concerns, questions. Being here during the public power hour, this is what I live for. So that's really what the campaign is about, really just putting all our issues on the floor and then going balls to the walls about it. Yep, I said that. I said
Sure. Oh my gosh. Yeah, I guess, does Max have a question? Max says, transitional demand should be tied to building a revolutionary working class labor movement.
Right. I do agree with that. I do
Okay.
agree with that. And this is why we really need to transform our labor unions. This is why we're pushing, when we talk about the Green New Deal, all green jobs have to be union jobs, because that's where we find that we as workers can democratically have a say into our workplaces. We have a say into what we are producing, right? Because we're human. This our labor is our production. It's ours. It doesn't belong to any boss man. It doesn't belong to corporate stakeholders. It belongs to us. So we should be saying and fully controlling what we produce.
Really want to emphasize how people can get plugged in. We'll repost the links to volunteer for Phara's campaign, as well as our utility strike toolkit and organizing your block, and being able to tell any COVID stories you might have. It's important that we share our stories and people understand that that this is happening to all of us.
It is.
Yeah, because people are isolated, and like, I think we need to share as many stories as possible so that people know what's going on, instead of just staying in their bubbles. And if they're doing fine in one apartment, they may not be doing fine in the next apartment. So it's important to organize and share.
Thank you so much. And
Thank you so much.
again, I hope to see you on the campaign trail on all the different organizing we're about to do. So I'll see you, everyone, and thank you so much for having me.